Hi, it's Chris from the Sevenoaks Chiropractic Clinic, and today we're going to talk about the link between stress and back pain. A lot of people don't realize how important stress can be in managing back and other kinds of muscle and joint pain as well. In fact, many patients that I see who come to see us for what they think is routine back pain, neck pain, shoulder pain, don't actually realize the role that stress can be playing as well. So we're going to dive into that. You'll also get a chance to see my fantastic art skills, so I'll apologize in advance for those. So let's talk about how this happens. So stress, as you're probably aware, is something that we tend to pick up with the brain. That could be stress from stressful job. It could be stress from kids running around, lots to do. It could be we're worried about something. It could be not getting enough sleep. All those things will start to cause stress, and that's generally affecting our brain and our nervous system first of all. So stress, first place it goes to is the brain. Now, you've probably heard of the fight or flight response. This is what gets triggered off when your brain perceives things as stressful. It starts looking for threats. It's worried that there's something wrong. It triggers off that fight or flight response, and that does a number of things. So that will start to cause adrenaline to go through. That'll start to dilate our pupils. We're basically on high alert. It's a survival mode. The brain's thinking we've got to get out of there. Now, that's great if we are really in a survival mode. If there's an emergency, if the saber-toothed tiger is jumping out of us, that's the example that's often given for evolutionary things. But whether that is, piano falls on grandma, someone's got to get the piano off grandma, that kind of thing. If for those really serious things, that's what fight or flight is designed for, and it ramps right up. However, modern life now, most of us tend to have just little bits of that constantly on. So that fight or flight response is basically being activated a little bit, but on an ongoing basis. I don't know why I drew an F. That should clearly be it. That fight or flight response there is going on little and often. And one of the things that fight or flight does is it activates the muscles. It gets the muscles ready for action. So that actually leads to muscles being tense. Because in the short run, tense muscles, they're kind of ready to go. You start protecting, you stiffen, vulnerable areas like the back, like the neck, the spinal muscles all tense, so that if anything jumps out of us, we're not going to get caught off guard and thrown off balance, or we're not going to injure our neck or back or head, those valuable areas there. So jaw tension, that's another one that tends to come in. Basically, the center of the body will tend to tense up more and stiffen the muscles. Great if we need to be ready for an emergency. Not great if that's happening all the time. So many patients, by the time they come and see me, this process has been going on for a while. And they might then have a problem. They might have another injury that comes in or another issue. Or this may by itself actually, in some cases, cause pain on its own. So now we have pain coming in. Well, guess what happens when you have got all this stuff to deal with and that starts causing you more pain? That's right. You're going to start causing more stress because the pain now becomes an extra stress. Now you've got to deal with the fact that your neck constantly hurts. So your back is waking you up at night, for example. So we've now set up a loop. And that's a problem because that is going to start recreating the issue. And that's why many people come to see us and they actually find that they're struggling to get out of pain. Things they used to recover from, they don't recover from so well anymore. And the pain starts hanging around because we've set up this pain, stress, fight or flight, muscle tension cycle there. Now, sometimes you can deal with that just by dealing with the pain. If you go see a chiropractor, an osteopath, a physiotherapist, massage therapist, they will deal with some of those things. So a massage therapist is going to try and break the cycle here. They're going to try and stop that muscle tension. You see a chiropractor, osteopath, or physiotherapist, maybe we're going to do something else. We're going to try and break it here. We're basically looking for links in the chain to break. So I'll make that red. That's what we're looking to do. Now that might work well, unless you still have lots of stress coming in. If you have a lot of stress going on, that's going to cause even more fight or flight, even more muscle tension there. And yes, you can have a massage. Yes, you can have a chiropractic adjustment. Yes, you can see a physiotherapist. But there's more water being poured into the glass all the time. So that keeps coming in there and it keeps coming back and just overloading this and re-triggering pain. So maybe you've had that where you go see somebody and it feels better for a bit, but then it comes right back. Or maybe this is going on so much that actually somebody releasing the muscle tension isn't enough to get you out of pain. So this whole cycle can get ramped up. That then makes it much harder to deal with just by getting somebody to treat the pain. In that case, really what you've got to do, you've got to go to the source. We've got to start looking at ways of dealing with that stress. Now, obviously, if you have a stressful job, it's not going to be that easy to just quit your job. I'm not suggesting that you do that. However, you might need to look at strategies where you can take the stress down a little bit. I had a patient just this week who had come to see me a couple of weeks ago, and I've known her for a while, and the stress was building up in her job, and I was noticing the last few times she came in, things were tighter and stiffer. She wasn't recovering as well from her issues, and she was starting to see me more often and actually need more work done each time, because this cycle was ramping up because of increasingly stressful situations at work. And when I explained this to her and I explained the role, and I said, I'm noticing you're not going in the right direction here, and it seems like if we keep doing this, it's going to keep getting worse. We'll become best friends because you'll be seeing me all the time, but that's really not what most of my patients want. They want to see as little of me as possible and still feel good. So we had a chat about that. As a result, she ended up stepping back. She went and she spoke to her boss. She got a different role, different area of the company, less stress, away from some of the more toxic environments in the workplace there. And this whole system started calming down. Now we started getting rid of some of that stress that got brought down the fight or flight, rid of muscle tension, and now that was enough to actually get rid of the pain, break the cycle, and she's feeling much better. That's a more extreme case, but maybe you don't need to do that. Maybe you just need to look at little ways you can reduce your stress. So obviously things like mindfulness, all these apps, breathing exercises, those have become very, very popular. A very simple one that you can do nearly anywhere is called box breathing, where you would slowly breathe in for a count of 4, hold it in for a count of 4, breathe out for a count of 4, and then hold out for a count of 4. So you see it forms this little box there of in for 4, hold for 4, out for 4, hold for 4. That's quite a good way of actually calming down the brain. It addresses things further upstream. It reduces the amount of stress in the brain, helps to calm down that fight or flight response before you even get to the muscle tension. So doing that, even if it's for a minute or two, even if you're just doing it while you're at a red light in traffic, you're sat on the train going into work or coming home, you've got a spare 30 seconds between the kids all needed feeding and homework and all that kind of stuff. That little box breathing, that can do enough to start to calm this down. You don't have to fix everything, but it can just start to reduce it down. Other things can involve getting out in nature. It sounds a little bit woo-woo hippie, I know, but there's really good research saying going outside in green spaces is really good for calming that down, particularly for kids. I've seen a number of kids where their chronic anxiety that was building up was fixed by going camping for a weekend or starting to play golf and just getting outside in some greenery. Very good for actually calming the brain down a little bit more. So there's some little strategies that you can do there that can make a big, big difference. One thing, though, that I will say is probably the most overlooked when it comes to stress relief is getting a good night's sleep. We are terrible in the West for disregarding sleep, for going, oh, well, I don't have time to sleep and not prioritizing it. Believe me, one of the biggest stresses to the brain is lack of sleep, because sleep is how your brain recovers from stress. If you're not getting enough, then things start to build up quicker than you can recover it. And over time, that can cause this cycle to kick back in, and it can cause neck pain and back pain. Getting a good night's sleep is really, really important. The other thing that with sleep is that when you're sleep deprived, you're terrible at knowing how tired you are. It's a little bit like the person who has 3 or 4 drinks. They think they're good to drive. They don't know the impact that it's having. There's lots of research on this. So most people, in fact, nearly all of us need between 7 to 9 hours. It is possible. There's very, very few people who have a gene that mean you can get by on 4 or 5 hours sleep with no problems. However, the odds of that are lower than being struck by lightning. It is millions to 1. Most people who say, I'm fine on 5 or 6 hours, they're like the person who's had 3 or 4 pints and thinks they're fine to drive. They actually don't know how sleep deprived they are. So sleep is one of the biggest things to try and improve. Going to bed and waking up a consistent time, not relying on the weekends to catch up and sleep. Getting some blackout blinds, having an eye mask. I sleep with an eye mask every night. It's really, really helped me sleep, especially in the summer when the light starts sleeping in. That can play a big role as well. Not watching screens right before bed. Scrolling on social media in bed is one of the worst things you can do for sleep. So trying to just reduce those habits and getting a good night's sleep, that's another thing that can make a big, big impact on stress. And it can calm this whole cycle down, and it can take you from somebody who needs constant treatment, whether that's with the chiropractor, constant massage, seeing your osteopath all the time, to suddenly only needing it occasionally when things flare up and finding you can settle and heal that much quicker. So Hopefully that's been useful for you. This is something that I wish more and more of my patients would use. I'm going to send this video to all of my patients because chronic stress, even low levels, it's endemic in our society. Everyone is struggling with this to some degree. And surprisingly, little things like that don't seem like they'll make a huge difference. Over time, try them for 2-3 weeks and see how you feel. And you might be surprised that chronic nagging tension that you're feeling could start to reduce down. So give it a try and let me know how you get on.